Thank you for joining us today. This presentation is being recorded. You can feel free to leave your camera off if you'd like. All participants are going to remain muted throughout the presentation, unless during the Q&A there's a reason to call on them for feedback. From our company, we have Rita Sheikh, presenter and moderator of this panel, Ava Tassiello, a speaker, Evelyn Vasquez Rendon, also a speaker, and Lisa Boucher answering Q&A. Dr. Kim Shamoon is online monitoring. She's the owner of the company and supervising. If you have any questions during the presentation, please feel free to post them in the chat and Lisa will address them. My name is Alan. I'll be handling technical support. There'll be a one question poll in a few minutes, and then at the end, there's a brief survey, which we would appreciate you doing both. With that being said, Rita, please take it away.
Thank you so much, Alan. So let's get started. Welcome everyone to Paraprofessional panel, Introduction to RBT and ABA. So this is our first panel that we're holding in terms of discussing overall what ABA is and giving you guys experiences of what our science holds, as well as how to go about the process of becoming RBT certified, the pros of becoming RBT certified, and the process overall and how that goes. So our two panelists that we have today, that I will get into more introductions very soon, are Ava and Evelyn, both who are currently RBTs and have lots and lots of experiences to share with you guys here today. All right, so Alan, do you want to post the the poll now? I would definitely want to know from folks that we have here today who we're speaking to, who are our audience that we have here today, and what your experiences are. Thank you. So what is your current level of experience in the field of ABA? So just let us know. We want to definitely see who we have here. So we have some experienced paraprofessionals. Nice. We also have a BCBA. I'll leave it on for just a few more. All right, cool. Thank you, guys. Excellent. All right, here we go. Okay, so thank you, guys. So definitely nice to see that we have some experienced paraprofessionals, and we also have a BCBA here that's taking part in this training. So thank you so much for joining and to completing the poll as well. So we'll have another poll at the end towards our presentation to get to know a little bit more about your experiences and what you want to learn more from our panel discussion moving forward. So with that said, let's get started. We have our agenda here today. So first, we're going to start off by meeting our panelists that we have, so Ava and Evelyn. Then we'll get into a review of ABA methods. So overall, what is behavior analysis? What is ABA? What is the science that we see and hear about so much? And then we'll get into the 7 dimensions of ABA. So overall, the science that we have, but as the development of this science has progressed, we've also have developed these 7 dimensions of our science. 7 dimensions that explain as to what methods we are using, how we use those methods, procedures, and what our purpose is with our science that we have and work that we do with our clients across settings. Then we'll have opportunities to ask our panelists questions that we have formulated for them to get experiences from them, their experiences in terms of how they became interested in ABA, how did they step forward into this field, where did they hear about ABA, where did they hear about behavior analysis, and what their plans are moving forward, and their experiences overall in the work that they've done so far. In the end, we will hold a Q&A. So questions that you guys have for us, we will definitely get to all of them. Either they will be answered through the chat, but from Lisa, or we will answer them here in our Q&A session at the end. Okay, so our panelists. Actually, before I get into the panelists, I would also wanted to introduce our folks that we have. So myself, I am Rita Sheikh. I am a licensed behavior analyst. I'm board certified as well. I have experience over the years in working with clients across different age groups. A majority of my kiddos have been from the ages of 2 up to 21 years old that I have worked with in across a variety of settings. We also have here Dr. Kimberly Shamoon, who is a program director of our company BIPS, and she is both licensed behavior analyst and board certified behavior analyst in doctorate level. We also have here Lisa Boucher, who is a master's, who holds a master's, and she's en route for licensure. So Ava and Evelyn. So Ava holds her bachelor's degree and she is RBT certified since December 2021. So fairly recent. So she has recently just gone through the experiences of completing all the RBT training requirements, competency assessment, for example, taking the RBT exam itself. And then from there, continuing her, maintaining her credentials since then. Evelyn Vasquez, who is also RBT certified. She's also in the process, she right now is in the process of getting her bachelor's degree. She has tons of experience across settings in terms of school setting, office settings with clients, home settings, and working with clients across different age groups, as well as different settings, as well as sessions that we've even had with dyad sessions. So there are more than 2 or more peers or 2 or more clients in one setting working together. So tons of experiences across both of these panelists here. So very excited for you guys to meet them as well. Okay, so behavior analysis, right? So we're going to get into now what is behavior analysis, what is ABA, what is the science that we have? So behavior analysis, it essentially is a natural science approach to understanding behavior. Why do we do the things that we do? I know one of the reasons why I was interested in behavior analysis was because I was interested in psychology overall, but I wanted to understand why we engage in the behaviors that we do. And that's exactly what behavior analysis allows us to identify our overt behaviors, the behaviors that we demonstrate. Why do we do those behaviors? And what are the reasons why these behaviors are maintained? What are the reasons as to why behaviors occur? Those behaviors might be approaches that we may have found reinforcement for in the past, or we may have even been potentially punished for those avoidance responses that we engage in. So those are all essentially a science of understanding the behavior and how it occurs in a paradigm of our environment. So behavior itself are, again, those overt behaviors, those kinds of actions and skills. And it's not just misbehavior. It involves behaviors that we're trying to increase, as well as behaviors that we are trying to decrease. Behaviors that we're trying to increase might look like in the form of initiating greetings with peers, making eye contact with peers. And misbehaviors, of course, also exist that potentially do cause challenging behaviors in their environment, their natural environment, for example. And that environment can include all sorts of physical and social events that may occur that, again, allow either the reinforcement of those behaviors or punishment of those behaviors. And again, the environment can include different social events. So they can be like we have experiences across the team that we have here on our screens today, experiences or social events that can be from the school, from home environments, from the clinical environment, office settings, across the board, work environment as well. So across the board, those are environments, those are naturally occurring consequences, naturally occurring environment that we are all a part of, and that impact our behaviors. And that's what the science that we have here is looking into. Okay. So another thing here we have is, again, it is a scientific approach to behavior overall. And now getting more into those several principles that allow us to describe how our behavior essentially is working, how learning occurs essentially. So we'll get into 7 principles very shortly, but overall, just knowing that behavior analysis has been a science that has been in the field of psychology since the 1930s, from the very beginning of Skinner and looking into the behavior of organisms, right? From there, now 2022, the field of overall has modified, it has progressed so much over the years. Just looking at overall in terms of our methods that we use, the procedures that we use. There's continuous research that is being done on functional analyses and modifying how to identify the function of behavior. That has been modified over the years, including methods to teach, methods, prompting procedures that we are using. They've all been modified, all have been progressive over the years, again, since 1930s up to now. And the settings, environments that we're in also have been modified. We have started off, again, behavioral organisms, right? Working on not necessarily always clients with the diagnosis of autism or with the diagnosis at all. Behavior analysis did start off with working with And it doesn't necessarily have to be the human population. It also works with animal behaviors as well. And that's where our science progressed over and over again. And now we're in across the environments. We're across school settings, we're in home settings, even looking into behavior management in office settings as well. So and the clients also are not just learners that may be in elementary or preschool age. These are clients that we see across the board who are going into adulthood, who are going into teenage years, dealing with social skills in high school, middle school environments, things like that. So overall, decades of research that has put into behavior analysis itself, that has helped us understand those antecedents. So what occurs before the behavior, as well as consequences. So what is the consequence of the behavior? What happens after the behavior? And so, yeah, that is overall in terms of ABA itself, or behavior analysis overall, the progression of the science. In the field of ABA, so behavior analysis put separately in the field of ABA itself. ABA itself is the use of those techniques. This is a science that we practice on a day-to-day basis, practicing using those techniques and procedures that have been researched and reviewed over the course of years, to address, again, socially significant behaviors, socially important problems, or challenging behaviors that learners may engage in or may exhibit in their different settings. And to, from there, bring about meaningful change that will allow for more inclusion in mainstream classrooms, more inclusion in their natural settings in their homes. So, for example, parents might be interested more so in the behavior that they want to monitor is just overall dinner time behaviors, dinner time protocol that they follow, the dinner time routine. And that's where we will work with them in improving that dinner time routine and allowing the learner, their client, him or herself, working on that dinner time routine with the family. That is a socially important behavior for that family. And that's where we are pushing in and working with them to improve and to bring about that meaningful change for them. So now we know what behavior analysis is. What are behavior analysts? What are we as professionals? So we are professionals in the ABA field, and what we do is we engage in scientific and comprehensive use of these principles. Right? We are the practitioners who implement the procedures that have been researched over the course of years, and to bring about these meaningful changes with our clients and our population that we're working with. And again, like I said earlier, that these are individuals varying from age groups, varying individuals, varying backgrounds as well, and again, diverse settings. Examples of these applications that we are working with now can be across, again, school, clinic, or home settings. They can also be working with in enhancing the development abilities and choice making of children and adults with different kinds of disabilities. And recently also going into more of the OBM, right? Looking into satisfaction of employees. This is something that we definitely take a lot of pride in at our company, in terms of incorporating the use of the science with our employees, with our own work, with my own work, looking at improvement of my own performances, and bringing about a meaningful change within the organization. Now we have a discussion about prioritization of targets. So we know that what is the science? We know that who are the people who are practicing this, but what are the principles? What are those targets that we are looking into in terms of modifying? What are these behaviors that we're modifying? What are the targets that we implement in ABA, in our work that we do in our clinical settings? So these targets range from behaviors that may potentially be threatening to the health and safety of the client themselves or to others. So these can be behaviors, for instance, pica, so engaging in behaviors of inserting non-edible items into their mouth that could be harmful for themselves, of course. It could also be behaviors such as elopement, if the learner engages in an elopement that could cause harm to themselves or to others. Tantrum behaviors, aggression, for instance, property destruction. Those are going to be our prioritization of targets. Those are going to be our first and foremost behavior that we want to modify and we want to change, bring a change in that behavior, to bring a decrease in that behavior, and to bring about, at the same time as decreasing that behavior, bringing about a meaningful change on behaviors that can be replacement of those. So instead of elopement, engaging in functional responses of saying, I want to take a break. I need a few minutes. Instead of eloping, instead of engaging in tantrum behavior, instead using a functional communicative response and saying, I need a break, I need a few minutes, let me be to myself, instead of having that aggressive or challenging behavior that can exist. That would definitely be our first priority to address. We also look at behaviors that may be a barrier, that could be barriers for learners in their ability to remain in the least restrictive setting, or could also limit their ability to participate in social settings, in the family life and community life. So if there are behaviors, like I said earlier, if there are behaviors that parents are interested in, that, I really would love to go to dinner with my son, out to dinner on Friday night to a restaurant, but my learner engages in a lot of vocal stereotypy. There's a lot of loud vocalizations that he engages in that just really is really distracting for other folks that are in the restaurant, and just becomes extremely difficult for us to have a dinner at a restaurant all together. And I would love to have him be part of that with us. That would also be a priority for us to work on routines, for work on a program of going to a restaurant and dining out, for instance. And that would be, again, allowing for that inclusion in their community life. And the other can also be, again, if you're looking into aggression or self-injury or non-compliance, for example, those behaviors can also exist that might be, or may more than likely be, the reasons as to why they are not being part of the least restrictive environments in their school settings even. So if those are the behaviors that are restricting them from being in the least restrictive environment, in the least restrictive classroom, that's going to be a priority for us to address those behaviors, to bring a decrease in aggression, self-injury, non-compliance, bring a decrease in those behaviors, to allow for more inclusion for them. And lastly, of course, we also have the absence of or the bringing about more adaptive and social functional living skills that learners that they need to be independent in their community. And these can be examples of this, can be toileting, dressing, feeding, compliance with medical procedures, for instance. Just recently we worked with a client who going to urgent care, for example, and getting blood pressure checked, or getting COVID tests, for example. Never thought this would happen, but that's where we are now in society, right? Getting a COVID test being completed at a clinical setting. So those are all, again, appropriate, adaptive, social and functional living skills that are applicable to their day-to-day life. And again, just in summary, summarization of what we have priority of targets is really to bring about more independence and independent living skills for clients across the board. And that those independent living skills can come out once we see a decrease in those challenging and more safety risks that the clients may pose, or more barriers that they may have in their environment, bringing a decrease in those to bring about more independent living skills. So now let's jump into applied behavior analysis overall, and then the 7 dimensions that I mentioned earlier, that there are these 7 dimensions that help us understand what the science is, where we're headed, and overall what is the basis of our science, and what is the basis of what we are looking forward to in our field, and what we think about in terms of when we design a program for clients or design target behavior for our client, what exactly is the reason for it and what we are trying to aim for with that behavior. So we have the 7 dimensions here, ranging from applied, behavioral, analytic, technological, conceptual, affective, and generality. I will get into each one of these in more detail in just a moment, but just being mindful that there are 7 dimensions. And I will also, as I'm going through these 7 dimensions, I will call on Ava and Evelyn to give their own experiences ranging from these dimensions and their personal experiences, clinical experiences that they've had with their work with their clients. Okay, so the first we have is applied, and applied really essentially is our science of changing behavior, right? So the interest that we have here is the interest in changing behavior. The behavioral interest is important to an individual and, of course, and to society, rather than the theory or set of theories, right? So even though this ABA itself developed from the study of organisms and the study and research that has been gone into this field, applied really in terms of ABA, the dimension of applied really looks into changing and modifying behavior to bring about the change in the interest of behavior of interest. The question that often we always have to ask ourselves when looking into the behavior that we're modifying is how immediately important is this behavior to our learner that we're working with or to our client that we're working with. Is this going to be a behavior that we can bring about socially significant change without modifying this behavior? What is learner being limited to? If this behavior is occurring, what is the learner not being able to access? What are some independent living skills that they do not have because of the absence of this specific target or this specific behavior? So applied really is looking into modifying behavior, changing behavior, but identifying how important is that specifically that behavior and how we can bring about that change. Again, into not in a research setting, but again, in our applied settings, in our clinical settings, in our home settings, in our school settings. What are those behaviors that needs to be modified in order to bring about a socially significant change for the client, as well as those that are around the client in the natural environment? Actually, before I move on, I would love to have Ava, if you could share with us an example of applied that you have experienced in your clinical work.
Okay, thanks, Rita. So similar to what you said, this behavior may be targeted as it could be socially important or meaningful to that client to change. One example I'm currently working with is aggression in a client, and this is important for their safety and those around them, but it also could affect their friendships and relationships in the school or in a diet play session or at the home with their sibling. This behavior of aggression is something that we're working on for those different settings and different people that he is surrounded with almost every day.
Absolutely. Thank you for sharing. And one thing to definitely make a note of here also is with the behavior, let's say that we're monitoring is aggression, let's say that behavior is not being requested to modify or to change because it's impacting others in their environment. It's being asked to modify because the learner himself is not able to access other stimuli in their environment. Because of aggression, they're not able to, just as an example, may not be able to take part in circle time with the rest of their group, may not be able to take part in lunchtime or snack time because they have to be excluded because they may be placed in timeout in school settings, for example. So aggression is not so much of like it's bothersome or difficult for the teachers in a school setting to address. It's more important because it's limiting the child or the learner that we're working with. It's limiting his abilities to take part in these activities with the rest of the class. So it's a perfect example that you gave, Eva. Thank you. Then we have behavioral, and behavioral is looking at measuring, right? So what we're doing here is we're changing behavior. And one of the misconceptions of ABA is that we are modifying people or modifying changes in things like that, right? In modifying personalities. That's not at all what we're doing here. We're modifying behavior. We're bringing a meaningful change to behavior. And what we're doing here also in terms of our science is measuring, being able to modify what observing of the behavior as well as, again, because it is an overt behavior, it is something that we can see, we can observe, and we can measure this behavior. We can see, because we are so data driven, to also be mindful of seeing if the behavior that we're trying to modify or trying to change or bring a change to is aggression, like you said, Ava. If that behavior is aggression, making sure that we can monitor what exactly aggression looks like. Is it going to be, how long of an instance should occur of aggression, or what should be the physical contact of the instant that happens? What would be qualified as an aggressive instance? And then tracking that. So using data to guide our decisions is what we're monitoring, our methods that we're using to change behavior. Are they even effective? Are they working? And having data be the guide there, right? So having data indicate to us that if our procedures are working, then we should see a decrease in aggression in those settings, in those environments. So being able to precisely measure the specific behavior that we're monitoring is, of course. And again, quantification of behavior. So being able to observe and to measure the behavior. And that exactly is what we're trying to monitor, is the change in behavior itself. Analytic, now, and in terms of analytic, we're looking at seeing the function of behavior, just seeing whether or not we can have that control over that specific behavior. So this often comes into play in terms of looking at behaviors that we are trying to bring a decrease to. So for instance, if the behavior continuously happens when a demand is placed, non-compliance continues to happen, non-compliance can be in the form of like having materials, not starting any of the material, not starting the task that's being presented. And it can even lead into tantrum or behavior such as tantrum or aggression. It could lead into all those different procedures or those behaviors. But it comes as an onset because the demand was presented. With the dimension of analytic, we get to see that if we present a demand, will the behavior turn on? And if we remove the demand, will the behavior turn off? So that's exactly what analytics dimension states here, is being able to turn on and turn off the behavior, and being able to have control over it. So oftentimes when we're trying to assess the behavior, trying to make sure that we can identify a functional behavior assessment, or we can identify a function-based treatment for this specific behavior, we want to see how we can turn the behavior on and how we can turn the behavior off. And those procedures are then going to be used to develop a treatment plan for that learner. Okay. Then we have technological. And technological is looking at those procedures that are described for high treatment fidelity. And fidelity that we're looking at here essentially is looking at the procedures that have been created, that a BCBA, LBA may design procedures that are in place for RBTs that we have here to carry out. Those procedures, are they followed through with fidelity? Are they able to be replicated? The terms that we're using, are they being able to be replicated in exactly how one person would present the demand, that is presented the same way by another person? So if we have a team across Ava and Evelyn, if the procedures are being implemented by Evelyn, would Ava be able to follow the same exact replication of that procedure? That's technological. And again, looking at the efficacy of implementation or replication. That's really the aim of technological dimension, is that the procedures that as they are written out, are they carried out the same exact replication of the exact same method or same way?
And I would love to just add something, Rita, before moving on. So this is one important component of the technological dimension, is understanding and reading the different components in that target. So maybe that's the definition of the goal that we're working on. Maybe that's knowing the prompt level that we're using, or following along how to collect data for that target or for that goal. Those different components should be detailed specifically and be easily replicated by multiple providers on that team for that client.
Absolutely, definitely. I was going to actually also ask Evelyn, because Ava and Evelyn are both on quite a few teams together. So I wanted to kind of hear from you, Evelyn, also in your experiences with this dimension of ABA in your work.
Yes, of course. I would definitely have to agree with Ava. It's definitely important to have the intervention procedure be as specific as possible, so we can all follow how to run the procedure, whether it's like a BST, whether it's very specific things that we're working on, just to be able to all run it accordingly for the learner.
Absolutely. Yeah. So if there's oftentimes oftentimes in terms of the measuring fidelity, what we want to also monitor, again, this kind of goes back into OBM and monitoring our own behaviors, monitoring our own performances. We might see that, okay, there's a decrease, there's a slight difference variability across providers in terms of when one person runs the intervention versus another person runs the intervention. There seems to be differential responding on the client's end. And that's when we go back and see in terms of how is the procedure being replicated. If there are modifications that are being made that just might be in terms of their own individual approaches, that might be the reason as to why there is such a variability in the client's performance. So making sure that it's exactly, again, for the benefit of the client, that the procedures are being followed exactly the same, replicated exactly the same. There, of course, are individual approaches that, again, your own personal rapport that you have with the client, your own personal personalities, of course, that you have across clients, and the work that you have with clients. But the replication of the procedures itself and how well they are outlined are what really guides us in terms of making sure that the behaviors of interest are continuing to be implemented the same across the board for the client's need. And then we have conceptual. And conceptual is looking at more of explaining the principles that we have here. So again, the principles that we have, all the different research that we have in ABA, that's exactly what we're practicing here in our field itself of our work here. And it's instead of being a bag of tricks, right? So these are not a bag of tricks that we are implementing or we're using, or just, apparently as like, I want to, bring about a change in this specific behavior. What are some tricks that you have? That's not the case. Instead, rather, it is more of discussion of behavior management, discussion of these are procedures that we have looked into in previous literature and previous research. These are effective procedures that have been used previously. These are what we have and what we can try and what we can see. So it's not a bag of tricks. It's rather a science basis that we have here. And using those principles in our own practical work that we have. So Evelyn, if you could give us an example of conceptual in terms of having systematic presentations of principles in terms of our practical work.
Yeah, so one thing that I can think of that I work with specifically with a learner is maybe like differential reinforcement, so like of alternative behavior. So for example, if we're working on a child, staying in a designated area, where we're working where they're not eloping, we can give them reinforcement for alternative behaviors. So, if it's either saying like, can I have a break, or, for staying in their seat and not jumping out. So you would give them reinforcement for that instead of elopement.
Absolutely. And again, it's not a bag of tricks that supervisor was able to pull out of a bag. Instead, these are procedures that are scientifically based and they have research background on them as well. So differential reinforcement of alternative behaviors, differential reinforcement of derisive behavior, for sure. So these are all procedures that definitely have principles and have tons and tons of research that is backing up the use of them and modifications to them as well, depending on the environment you're working with, depending on the client's population, depending on the age group that you're working with. Definitely, for sure. That's a really great example. Then we have effective, and effective is looking at how much of the behavior we're seeing that change, we're seeing that continuous change in the behavior and continuous change across settings. So for effective really is in terms of looking at, were we able to bring about the meaningful change, especially significant change that we had set out originally? Were we able to bring about that change? Was that procedure that we implemented, was that effective? Was it effective in terms of producing large enough effects, practical value? And examples of this can for sure be that if you're working on a client in a home setting and you want to bring about a change in terms of looking at more of engagement with their sibling, what parents want to see there is, yes, you have these one-to-one sessions with the client and you have one-to-one possibly diet session with the client and the sibling, but is the parent seeing those meaningful changes outside of the sessions? That's where we look at effective. And that's really heartwarming for us as practitioners, because when we hear from parents that we are seeing these changes outside of sessions, that's beautiful for us to see and to hear. And that's when we really know that our science is working, our work is effective. Because that change or meaningful change is being seen, the effect has been large enough to be able to have practical value, that change is being seen across settings and is being seen across outside of our one-to-one sessions, it's being seen across that. And that's really what effective really shows, is that meaningful change is being seen across providers, it can be seen across family members, across settings. Ava, if you'd like to give an example of effective.
Sure. And another thing is that although this change is valuable for that client, we also consider the direction, or we consider the amount of time we have been working on this behavior or this skill. If it's been a certain amount of time that has passed and we're not seeing a change, that's when we may modify the plan or modify what we're doing to help them be be successful in that.
Absolutely, absolutely. And it always goes back to the question of why are we addressing this? Why are we bringing this change of behavior? Why is this target behavior that we have? And if we're trying to see that the behavior is not being modified, the behavior is continuing to see resistance, what are the reasons for that? And then taking a step back and being flexible on our end, taking a step back and accepting, okay, sure, this is not being modified. Let's just reasons why this is happening. What can we do in terms of bringing about the more effective change? It might be that we need to modify the definition of the behavior itself needs to be modified. It could even be the setting that we're working on. Behavior itself is not effective. So definitely the question then goes back to what are we doing wrong, rather than not what's wrong in the environment, what are we doing wrong in our own work there? What are we doing wrong in our procedures that we're implementing and modifying those? And lastly, we have generality, and this is looking at more of lasting change, right? So behavior change, the behavior itself producing enough in therapy should be durable across situations, people, and stimuli. So kind of going back to effective and how much of a noticeable change that parents are seeing, teachers are seeing, other peers are seeing. Generality is the same thing, is that change is long lasting, and it's continuing to last across settings. It's lasting across even after we've modified the programs and we've moved on to another target. That change is still being seen. That change continues to be in the client's repertoire, and it can also be generalized to different settings. And this is oftentimes, for sure, it is programs rather than accepted. It's not something that we hope for, that we would hope to see a change in once we teach this behavior in a one-to-one setting. We hope that we can see a change with the peer. No, it's not hope, it's more of a planning for that. So we may start off with working on a structured gameplay with our client in a one-to-one setting. We may start to play a board game with the client one-to-one. But we will plan for generalization. We'll plan to say, okay, now the game can be played with us one-to-one. Now let's introduce a peer, and now let's have the game be played with that peer, so that we can plan for generalization. We can plan for that skill to be in that client's repertoire across settings, even when we're not there. That's the goal, is independent living skills. The goal is when we're not there, can the learner still demonstrate these skills?
I just also would like to give one more example.
Yeah.
One other example that this could be seen is maybe a client is engaging in tantrum behavior. Maybe they're falling to the floor and crying or screaming when an unpreferred item is placed in front of them. So one thing maybe I work on with the client is saying, I don't want this, or can you move this with me? After some time of them being successful in that, maybe now they say it to their mom or their dad. Maybe they say it in school with their teacher. That skill is then moved across different settings and people where they can express, I don't want this item in front of me, or if you could take it away.
Yeah, absolutely. Great example for sure. Thank you. Okay, so just going back again to the 7 dimensions, and just an acronym that I used when I was looking into the ABA and learning more and more about these dimensions. Acronym that is very common is get a cab, right? So that's oftentimes, if you ever forget what the dimensions are, get a cab. It's a great acronym to use across the board, across these 7 dimensions. All right. So now let's get into asking our panelists the questions that we have for them. So I'm going to put what I have here, the questions overall, and just so that if anyone's joining us in at different times, or if for any reason you have to step off the screen for any moment, we can always go back and you can see which one we're discussing. So right now we're going to start off with why did you choose specifically this field? So if Ava, you can start off with answering this question of why did you choose this field?
Sure. So ever since I've been able to work, probably about 15, 16 years old, I started working with young children and those that are special needs. Throughout the years, I've been a camp counselor and working in schools. And while in college, I had the experience of being a peer mentor. So that meant I worked one-on-one with the student, a college student on the autism spectrum. And I really, really enjoyed that. I enjoyed working as a team with those who are also peer mentors and in Bridges to Delphi. And I wanted to carry that over and find a setting where I can do that one-on-one experience with a client or with a kiddo and move on from that.
Thank you, Ava. Evelyn, why did you choose this field?
So initially, I heard about this field through a close family member, and I thought it was pretty interesting. So I wanted to try it out and gain some experience since I am majoring in psychology in school. And ever since, I've been falling in love, and I've always loved working with kids. So that was also motivating for me to try out this field, and it's been great. You're muted, Rita.
Okay. Well, we definitely are glad that you chose this field for sure. Thank you both. So this time we'll start off with Evelyn. What are some tips that you have for a new paraprofessional that just recently started in those fields?
Well, to start off, you're most definitely going to get a lot of training. So whatever you may not understand, it's important that you ask questions to your supervisors or even to other providers, and don't be afraid to speak up. And
Yeah, absolutely. What do you think, Eva? What are some tips that you've gotten over the years in terms of new paraprofessional?
Two tips that I have for a new paraprofessional is to maintain professional boundaries. And this is especially important because you do form a relationship with the family, seeing them so often, but you are giving a service to them and their child or to the client. So maintain professional boundaries, be professional. If any, if anything comes up where you feel uncomfortable, always reach out to your supervisor as well and just let them know what happened and what's going on, so you don't feel alone and that you know how to respond in those instances.
Absolutely. And I would say definitely for sure across both of you guys definitely do implement that for sure. Is whenever something happens, when an issue comes up, for sure, definitely that we supervisors will get either a text or we'll get an email letting us know immediately. So we're really definitely appreciative of that. And just overall keeping the team informed as well, because there might be, like you said, there might be things that you may have experienced in your session or something that may have come up in your time with the client. And instead of assuming that, okay, this just happened in my session, but letting the team know so that everyone across the board is informed for sure is very important.
I also wanted to add, always be open to like corrective feedback. So any programs you may be running, if your supervisor gives you feedback on what you can do better, always apply it, because remember, this is for the benefit of the child. So yeah, it's important that, we take that feedback and we apply it as best as we can.
Absolutely. And then on our end, I think in terms of our experiences so far have been that identifying what are those methods of feedback that we should deliver, what are methods or modality of feedback that you would like to receive. So whether that feedback is something that you want to receive in the moment in session, or would you prefer to receive that feedback after the session in writing? So identifying, also letting the supervisor also know that I would like to receive feedback, not in the moment because it kind of messes me up in the session. I just can become really rattled. Instead, if I could receive that feedback in a meeting afterwards, that's perfectly fine to express it. It's more preferred if you would let your supervisor know also in what modality you would want to receive that feedback. Okay. Ava, what do you think are questions that you should ask, or what questions did you ask when you joined the company?
I think one thing that you can ask, or really more discuss is talk about what you're looking for when joining a company or an organization. Maybe the roles and supervisors, what you're looking for in that. Different things different things or different expectations that you have when joining, and see the responses. If it doesn't align with what you're looking for, maybe try somewhere else, or maybe modify something.
Definitely.
I also kind of want to just add on to what Ava said. So like maybe something specific can be, you can ask your interviewer like how they handle difficult situations, and this can be important for you. So you can ask like and know if you're getting the right support or the proper guidance in difficult situations with clients or with even the parents of the clients. So yeah.
Yeah, absolutely. I can say for sure that you guys definitely have. I'm just thinking about sometimes of when you guys interviewed for to join our company, question that you guys had for sure were extremely, really well thought out in advance for sure. Thinking back to when I joined my first company, that was not the same. I didn't have those questions in mind. I didn't know. But again, it comes with experience and your experiences that you have at first. Those experiences are going to be then your setting ground for what you look for next in upcoming. So for sure, if anyone that is part of our meeting today is experiencing a company that you may find that you are not receiving appropriate feedback or you're not receiving enough support, that's something that you moving forward you would ask for that in the company that you would interview for sure. What to expect when you join a company? Either one of you guys, Evelyn or Ava.
I would jump in. I'll jump in. When you first join a company, it's important to note that you're working with other team members for this client, or even the school teachers at his school, or the family members. You're not alone providing this service. So working together with everyone else, working with those team members and just communicating with them to strengthen and build that bond and the relationship with each other for that learner.
Yeah.
Kind of going back to about before, also just expect, corrective feedback and expect, to take that corrective feedback. Yeah.
Yeah, definitely. I think oftentimes like what we struggle with most, possibly even when you first join a company or when you first start working with clients in this field, specifically, is that corrective feedback. It's that corrective feedback that we receive in terms of our protocol implementation or our session note writing, for example. Like documenting our work that we're doing with our clients, and that we're receiving that corrective feedback and being mindful of that feedback, and then making those effective changes to bring about again the work that we want to, because we are working with families, we are working with clients in different age groups for sure, but it's a very personable experience that we have. Often working with families in their homes, and we on vulnerable populations as well, and working with families specifically also in settings or situations that are more difficult for them. So absolutely, being mindful that you definitely do have the support, and reaching out to supervisors, reaching out to other team members whenever you need the support for sure. It's something important to always keep in mind, that that's something you could always expect from a company for sure. Next question we have here for you guys is what to expect when you have your first session with the client.
So I just want to say, don't expect it. It might not be easy at first, but that's why, you can ask questions, and you will have the support most likely of a supervisor or maybe even another provider if you're overlapping with them. So, just expect, you're going to have a lot of questions probably, and don't be afraid to, speak up and ask any questions you may have.
Absolutely, yeah.
I definitely agree, Evelyn. That first session that you may be overlapping with another provider, definitely take advantage of that. Ask questions like you said, or ask for something to be modeled. Maybe pay attention to transitioning, how they transition from one thing to the next, or their routine, maybe their preferred items or their non-preferred items, and just really get to know the client that first couple of sessions.
I think for this, from my own experience, the thing with that, you can never be over prepared for your first session with any clients. And even now, like if I meet with a client for the first time, I do still get very nervous in terms of meeting that new client, because it's exciting. At the same time, you don't know what the difficulties, challenges the client may present with, what the needs the client may have. So we can never be over prepared for your first session, for sure. So now kind of getting a little bit more into the RBT training and the RBT certification. So what would you guys say are some of the benefits of becoming RBT certified that you both are now and are maintaining those credentials? But what are the benefits that you guys have experienced?
Yeah. Go ahead.
Sure. So collaborating with my supervisors and working together and assisting my supervisors a little bit more for the client really is valuable to me. And I'm learning so much being more hands-on and working closely with my supervisor to benefit the client.
Yeah, definitely.
I would say that a big benefit can be like, you can learn this in a class, but actually applying it, working hands-on with the client. It's very helpful and very amazing, to learn, all the concepts and everything you learn in ABA.
Yeah, absolutely. So the process of becoming RBT certified, what was the process for you guys? What are the experiences that you guys have had from the first initial interest in becoming RBT certified to now where you guys are? What has been the progression and experiences that you guys have had also? Yeah,
so, well, when I started as a paraprofessional, I got RBT training. So that was, modules that we learned online. And I also got training with a supervisor. And then it went on to, once we completed the training, then we did the competency assessment, just to make sure that we have knowledge of what we learned and, that we can apply it with the learners, or whether it was a role play with the supervisor. And then to taking on the exam. So, yeah.
Yeah, absolutely. Thank you.
And one tip I would have for becoming RBT certified and taking the exam is to prepare to study what you're comfortable with, whether that's taking notes, doing practice exams, asking other questions, or asking for clarification on something. Do what works best for you and give yourself enough time to study and review the material.
Yeah, absolutely. And I remember both of you guys were extremely nervous when you guys were preparing for the RBT exam. But you guys, of course, did fantastic on the exam itself and the assessment as well, competency assessment that you guys had to also have completed. But you guys did both fantastic. Okay, now let's get into a discussion of school versus home sessions, because both Evelyn and Ava, both even collaborating on a team right now, are working with a client, both that same client, both in the home and in the school. And the sessions look obviously very, very different, of course, but are some differences that you guys are seeing in the school versus home with that client?
Yeah, so some differences that we may have can be like the programs itself. So in school, we can be working on something like, staying in the designated area when, when everyone comes together for circle time or whatever they're doing. Whereas at home, we can be working on things related maybe like to the sibling or other home things, like maybe, I don't know, if we're working, on chores or things like that.
Yeah, definitely.
I definitely agree, Evelyn. And another thing is that although we may not have those same goals, definitely try to take advantage of opportunities outside of the home, maybe in the school or another setting, in the clinic setting, office setting, taking advantage of those naturalistic teaching opportunities to perform or to run a skill that you want to work on.
Yeah, absolutely. I think, in the home setting, we oftentimes, if there is a sibling, we can have definitely control opportunities. But if there isn't a sibling in the home, something is not available, for example, we have to contrive opportunities, not so naturally. Then, in that case, it's more of contrived, and it becomes like a little bit more of not so much of a natural setting. But in the school environment, you definitely have so many peers that you can work on. Again, this is a learner who requires a lot of social, like working on a lot of social language and like repertoire and things like that. For sure, in the school environment, you'll definitely have a lot more natural opportunities for there in that case. And in the home, it's not so much. In the home, it's more of one-to-one environment, one-to-one play session, one-to-one work that you may be conducting with the learners. Targets definitely are going to be very different, like Evelyn, you said. In the home, there might be targets that are, again, that can be worked on one-to-one, whereas in the school, there's a programs that you're working on with the learner that are not one-to-one. You are in the school setting, you are trying to incorporate yourself and assimilate yourself in the classroom environment so that you do not stand out as that you are there just for the client. You are actually there for the rest of the class and just making it be more natural as possible. So for sure. The next question actually that I have for you guys is how to individualize approaches. So both of you guys definitely have your own individual approaches to work that you have with your learners, have your own rapport that you have with clients, of course, as well. But what are some tips that you guys would give of how to individualize your approach with working with clients across the board?
Sure. One example of this is knowing and using different strategy methods for different learners that may engage in maybe the same problem behavior. Maybe one client doesn't respond well to if you ignore that behavior, while maybe another client, it does work for them. So just knowing and understanding what or how they will respond to that, or how they will respond to you reacting to that, and just using different strategies and being open to different strategies with clients.
Yeah, absolutely.
So for example, like if you're reinforcing a learner for a good behavior, just individualizing like what are their preferences, what do they like, whether it's watching videos during their break or edibles. So yeah.
Yeah, absolutely. I think another feedback, but I think one of the things that an old professor of mine had shared with me was that, she was extremely energetic and extremely loud when in terms of delivering behavior specific praise. And that doesn't work really well with all clients. So there were learners who it did not work with at all. And that would actually serve the opposite effect. It's actually more aversive than anything else. So being mindful, like you said, being mindful of the preferences the client may have, being mindful of the approaches that you may have had in terms of behavior or behavioral plan that you may have for another client. Being mindful overall that there are behaviors, function of behavior is across the board. There are functions of behavior exist that we know. It could be that they're trying to escape from demands. They might be trying to access tangible items. That we're trying to get social attention. Then we're asking for tangible items in response to that behavior. So just being mindful of the behaviors and the functions of behaviors is helpful to understand that the behavior is happening for X, Y, and Z reasons. You may not necessarily always know that this is what's going to turn the behavior on and off without doing a functional analysis, but still being aware that these functions of behavior exist. And if the learner is engaging in this behavior, immediate response to give that behavior attention is not always the best thing to do. Always giving the response of, oh, don't do that is not always the right thing to do in across the board for learners. So definitely for sure, I would say that be mindful of approaches and being mindful also of the client's preferences and things that they do not like as well. Okay. So now we have a question about how to talk to clients' families. And this becomes really important in terms of we are working with clients in their homes, working with clients and families very close. So we definitely have built great rapport with the families, but at times it becomes really difficult, like you said earlier, Ava, is to not overstep that professional boundary. So how to talk to clients and how to talk to clients' families rather. And that can also include clients' families. It could also include clients' teachers if they're working in a school environment, working with clients' teachers, and to again maintain a professional boundary with them as well.
Yeah. So I just want to jump in. Yeah. I would say definitely, speak to them in a respectful manner. There are clients' families or even clients' teachers, who like to hear, how they did in a session. So just being able to answer those questions respectfully. And I also want to add on that if there's anything that maybe a client's parents, if they have questions and you don't feel comfortable answering, you can also, you can always, tell them to reach out to a supervisor, or you can let a supervisor know. Because sometimes, they may have questions that we're not able to answer, but supervisors definitely can.
Yeah, absolutely.
I'm sure. So this could also include maintaining client dignity in the home or outside of the home, but maintaining client dignity. So speaking about the child or about the client in a respectful manner, not speaking about the client maybe in front of them, using appropriate language, just being respectful of that client and their family and talking to them in a way that's definitely professional and not overstepping.
Yeah, absolutely. It's hard to do that too. Also, if the client is like 2 or 3 years old, and but that is a client that's also respecting their dignity as well, of not talking about them, with them being in the present. So that wouldn't be respectful to you. So you wouldn't want that to be for them as well. So that's a really great point. How to approach supervisors professionally. So again, going back to how to seek that feedback, how to seek supervision, and guidance on also ethical issues that can and do come up in your work.
Yeah, so how we've said previously, it's if you have any questions, you can always approach supervisors. You can always ask them questions, whether it's during supervision hours or if you feel like it's it's not that it's urgent, but if you feel that you need to reach out to them as soon as possible, you can always send them an email, and yeah, just wait for the appropriate time for them to answer. And as we've said multiple times before, seeking and also accepting feedback, whether supervisors go in to supervise you, they may have things that they may have feedback that you can with things that you can change, with the way you're performing the protocols. And yeah, just always being open and respectful to the supervisor that is giving you that feedback.
Yeah.
Definitely. And also, if you do have any comments or concerns that you want to relay to the supervisor about your session, to try and be specific about what's going on, what's happening, what is the client doing, what behaviors are they engaging in, and just giving a little bit more information, a little bit more detailed information about what's going on to help that client and to help the supervisor know fully and understand what's going on.
Yeah.
I also want to add on, not only seeking, when you're seeking for help professionally, just always also be aware of like what is an appropriate time. So, if something is not too urgent, then you shouldn't be, reaching out to supervisors like during your sessions with the client, because, your attention should be on the client. So if it's not that urgent, then it can wait. You can reach out to them before the session or after the session, but also, keeping in mind that you don't want to take away time from the child.
Absolutely. Great. Thank you guys so much. It's a really great answers you guys have. I think it's really going to be really helpful for our folks that have joined us today. Okay, so I know that we definitely do have a compiled questions that we also have, Lisa. So if you could let us know what questions have come your way in the chat, and we definitely have time to answer a few.
Yeah, absolutely. So I did kind of separate them. So first I'll start with the questions that came up when there was discussion on the 7 dimensions and the intro to ABA. So there were 2 questions that came up. So then I'll open the floor to Ava and Evelyn. But the first was, is it the RBT's responsibility to figure out what targets should be worked on? And if it's not, whose responsibility is it to pick out the programs that are worked on?
Well, for most clients, they probably have a lot of programs that need to be worked on, that are being worked on. Sometimes you may not get to it all, but it is your responsibility to keep up with, the modifications that supervisors may make on programs. And so it is up to you to, run these programs. And there are other programs that may be ran more consistently than others. Some programs may already be in maintenance, so maybe the supervisor may tell you that run this one once a month or twice a week or things like that. Whereas there's other programs that we're working on still currently in intervention, and they should be worked on at every session. For example, like a behavior reduction target, if we're working on problematic behaviors like, frequency of rough play, you would want to work on that every session, keep date on any occurrences that may happen.
Awesome, thank you, Evelyn. And then the second question was, what is the RBT's role in the use of the 7 dimensions? I know you guys touched on it a little bit with each giving your examples, but if either of you could elaborate a little bit more on your role in the use of those 7 dimensions.
Sure. Just to clarify, did you want one specific one or just one specific one?
I think just overall, is it something that you're working on across all of the programs, or only some of the programs touching on those dimensions? How often, are you being aware of your use of these concepts?
Sure, I'll start. For right now, I'll bring up consensual dimension. So that is something that is research driven and based on behavioral principles. So an example of that could be functional communication response or a replacement behavior. So going back to maybe, let's see, I just want to bring up a specific example. Maybe behavioral. So we're observing and measuring the client, maybe like Evelyn said, the frequency of rough play. So using functional communicative responses, we can teach them and they can utilize to say to their sibling, I want this one, or I don't want this one. They can communicate better with each other. So those 2 examples and those 2 dimensions definitely we utilize throughout our sessions.
Yeah, I also wanted to add on, sometimes we don't even notice that we may be using the 7 dimensions, but we definitely do. So for example, like how we talked about like generality, like, if the program that we're working on with the client, like, is it being generalized like to other environments or to other people? So for example, if we're working with a child that, is learning how to tolerate losing in a game, they will learn that with us, but, then the next step once they master it with us is to see whether or not they can generalize it to, the outside environment. And then maybe we would work on with starting off with like a sibling or a parent, and then it can go on to, instead of working, on games, in the basement of their home, we can work on games like at another person's house or like outside, just generalizing for the child.
Great, thank you both so much. To continue on, so now I'm kind of going to go into the questions that came up during more of, the panelist questionnaire. A lot of the questions did have to do with the RBT training and what that all looked like. So the first one I'm going to start with is, how long does the RBT training take?
So it is a 40-hour training, the online training, and you do it at your pace most likely. So whether it's, you spend an hour a day working on modules, and they're like, the modules are split into basically what the second edition task list is for ABA. So there could be, it starts off with like, measurements and things like that. And you work your way through it. So it's almost a 40-hour training, but it could be a little longer maybe, depending on your pace.
Yeah, definitely a 40-hour course, depending on your pace as well as your performance on it. And I believe it depends on the performance level, but I think you have to score a certain amount to move on. So before moving forward, you do also have to score a certain amount correct in that module to continue. Yeah.
So the format of the training is kind of like, like a quiz. So you have to, I believe like what you need to score is at least an 85%, to be able to move on to the next module, to move on to the next thing that you're learning.
Great, thank you. And then kind of to go a little bit further into that, the next question was, how do you access the 40-hour online RBT training? And is that the only online training option, or are there specific companies that you would suggest that have a good online training? How does that work?
Okay, so I think for the most part, if you start off with the company, they will provide you with the training, but that may vary depending on the company. So they would provide you with the information. So with the website that you're going to be using, I believe there are different ones. I don't know if Ava or Rita, you want to add on.
Yes, I'm not very familiar and don't have much information on those other RBT websites as well.
Mm-hmm. Sure. So definitely the one that we have in the past, we have done the training, in-house kind of thing, where we provide the training itself of the develop up until the 40-hour training, but there are websites that we have been referring to now more that is more self-paced is the BDS modules. And those are the ones that I would definitely recommend. Even BDS modules have also been used in terms of just studying for the board exam, also to become board certified as well. They have really great resources for the RBT level as well, in terms of the training and the coursework that's needed to become working up to the competency assessment. But that would be BDS modules.
I also want to add on that we also have RBT training with a supervisor. So we may meet I don't remember, but I think it was maybe once a month. And we would discuss, certain things that we learned, in the modules that we've been working on in the training. And, any additional questions you may ask, you can always ask whoever is training you. Just to get a better understanding. Sometimes it may not be as easy. You may read it online, but you may not understand it. So you may have additional questions. And during that RBT training with your supervisor, it's definitely helpful. And you should be asking other questions if you may have. And they will be presenting you with a slideshow and, just kind of going over what you may have already learned in the training, and just to expand on that.
Thank you guys so much. And I also wanted to point out that if you look in the chat, Alan has sent over a link of the one that we use here at BIPS to access it there. To move away from, the certification and that whole process, we did have a few other questions. So another question that came up was that if you have questions regarding session structure or procedure, who would be the first person that you go to get a better understanding of those components?
Yeah, so you would definitely want to reach out to your supervisor for better understanding, and how we spoke about before, just find an appropriate time to do so. So if you have a question during the session, just ask yourself, is it really important right now? And if not, then you should ask after a session. So you can reach out to them by emailing them, or, during their supervision, during when supervisors come in to supervise, you can also ask questions during that time of anything that you may need. They will help you.
And going off of that, Evelyn, definitely being up to date on any updates or modifications to their protocols or their goals will definitely be helpful. So you know in advance maybe something you're unclear about or may need more information about.
Yeah, and I also wanted to add on that you can also reach out to other providers as well. It doesn't always have to be your supervisor, but yeah.
Absolutely. Thank you both. So we'll have about 2 more questions before we wrap up the question and answers component of our training today. But the next one is going to be, do all sessions in the home have the same structure across clients? So I know we spoke about the difference between home sessions and school sessions, but in regards of in the home, are they always looking the same for every learner that you work with?
Yeah, so kind of going back to what we already spoke about, we always want to build rapport with our learners. So we always want to individualize our approaches. So for some learners, you know, we may use DTT, which is basically, you know, one-on-one, sitting at a table, running programs. Whereas with others, you know, it may be more naturalistic, you know, we'll sit at the carpet. So it's not, it can be structured, but it depends on the client, you know, not all learners are, you know, receive tokens, like some that doesn't work for them. And it depends on the learner.
Yep, definitely depends on the learner, what they're working on, maybe their home setup even, if they have a daily schedule and they're more structured, or versus they don't have a set schedule and they're more flexible, and changes in what we do definitely will depend on the client themselves.
I would say it definitely depends also like on their skills and what they already have in their repertoire, of how sessions would be run.
Awesome. Thank you both. And the last question that came up was, in what form do you usually get feedback in? Is it immediate? Is it written? Is it verbal? Or any other form?
So I would say it can be immediate. So like if you're running a program, a supervisor may say, oh, like instead of, like, let's say if we didn't deliver behavior specific praise for something that a child did right, they can say, oh, like don't forget to deliver behavior specific praise in that moment. There may be instances, maybe if, you know, what we're running is, or, you know, is a lot, then maybe the supervisors will wait until after the program is finished. But I would say it's pretty much immediate, like in the moment, in the session.
All right. Thank you both so much for answering all of those questions. And thank you for everyone that submitted their questions. I'm going to hand it back to Rita and Alan so we can wrap this up.
Thank you so much, Lisa. And thank you, Evelyn and Ava. You guys did a fantastic job answering the panelist questions overall that we had for you guys, and as well as the questions that we have from our attendees today. And again, thank you all so much for submitting the questions as well for Ava and Evelyn.
Yeah, thank you, Rita, for putting this together, and thank you for everyone that participated. And please make sure that if you can, please do the survey that should be on your screen post-event. It's pretty quick.
All right. Thank you so much.